As hospitals around the world buckled under the weight of the pandemic, 23 million children missed out on routine vaccinations in 2020, putting them at risk from devastating but preventable diseases like measles, polio, and meningitis. The World Health Organization warns that unless urgent action is taken, we risk trading one crisis for another. Welcome to our COVID-19 special. I'm Monica Jones. Good to have you with us. Well, it's a bit like sitting between a rock and a hard place, isn't it? Better avoid doctors' waiting rooms and clinics so you're not exposed to SARS-CoV-2, but at the same time, miss out on important health checks and treatment. Now, that's tricky for all ages, but especially risky for kids. Polio is a life-threatening disease. It's caused by the polio virus, which can infect a person's spinal cord and cause paralysis. A polio vaccine exists since the 1950s. Measles is a highly contagious infectious disease, and once a person is infected, there is no specific treatment available. Most of those who die from measles are less than 5 years old. A vaccine against measles was introduced in the early 1960s, which means these and many other typical and cruel childhood illnesses can be prevented if only the coronavirus pandemic didn't get in the way.
It's a disease they never should have gotten. These infants in Congo are suffering from measles. As COVID-19 has ravaged healthcare systems around the world, millions of children have been deprived of routine vaccinations.
So the COVID-19 pandemic has set us back a decade when it comes to the progress reached by childhood immunization. The coverage rate of diphtheria, tetanus, and pertussis has decreased by 3% from 86 to 83%. This means that we are missing out on life-saving immunization for 23 million kids, and 70 million of those have not even been reached by one single vaccine.
Around the world, reduced access to clinics, fear of catching COVID-19, and challenges reaching services due to lockdown measures have all contributed to a sharp decline in children getting crucial vaccinations. Experts warn that a further loosening of pandemic restrictions could lead to multiple outbreaks of preventable illnesses.
If countries are continuing to loosen their public health and social measures, in spite of what we're saying about COVID, that we're not past the worst yet, and vaccines are continuing to roll out for COVID. So now is not the time to release public health and social measures. But if that's happening, and as it's happening, we are going to see more and more transmission of the pathogens that are otherwise vaccine preventable pathogens.
The World Health Organization says action is urgently needed to ensure that the COVID-19 pandemic does not deflect from the need to protect children from other deadly and avoidable diseases.
And Dr. Kate O'Brien, who we just heard in that report, joins us now. She's Director of Immunization, Vaccines and Biologicals at the WHO. Good to have you with us. So when we talk about 23 million children missing out on basic vaccines in 2020 due to the pandemic, are we talking about children primarily in developing and poorer regions, or is this a problem across the globe?
You know, these children who have missed out on vaccines are really seen in all countries around the world, but they are predominantly found in some of the regions more than others. So in particular in the Africa region, is one of the areas that is particularly hard hit, as well as the Southeast Asia region. But I want to emphasize that this is not just a problem of poor countries. You know, on the list of the top 10 countries that have unimmunized children, we find countries like Brazil, the Philippines, and Mexico. And this is partly attributable to the size of the country. Big countries have more opportunity for unimmunized children, but also the missing out of vaccines and a slippage in the program coverage.
And what consequences has this had so far? Do we know?
Well, in part, for some of the diseases that our children are vaccinated against, it's a bit too early to tell what the impact will be. There are very considerable efforts being made to try to catch these children up, to try to find them again and give them the vaccines that they missed in the course of 2020. But we're also starting to see measles outbreaks in some countries. And measles, as you know, is one of the most transmissible viruses and one of the viruses that really can harm a child's health, even if they survive the illness, for years to come afterwards.
And how much, you say we're sort of trying maybe to catch up. How much leverage is there in terms of timing? If health services everywhere were to pull their sleeves up and start doing routine vaccinations for kids again, can we catch up?
We certainly can catch up, and there are a number of different ways that country programs catch up. First of all, making sure that parents know how important it is to bring their kids back or initiate vaccination, even for those kids who didn't get the vaccines at the point when they were, the very earliest age as little babies. The second is that there are campaigns that can take place. We can strategize in a different way so that vaccines can be given, through a special program where parents and the whole community is informed about the importance of coming to get kids vaccinated, especially those who have missed out. So we do have lots of ways that the catch-up can happen. And what we saw in 2020 is that things were really pretty bad in March and April. Programs really fell backwards in terms of what they were able to do. But many countries made a very special effort and caught up a lot in the second half of the year, and especially in October, November, December. Mm-hmm. We have seen a slip in the coverage. It wasn't as bad as it could have been, but we're definitely not out of the woods yet by any stretch of the imagination.
Right. And of course, now there's also the question about vaccinating kids against COVID-19. There are pros and cons. What do you say?
Well, we don't have any vaccines that are authorized for use in children below 12 years of age. And we only have 2 vaccines that are authorized for use for teenagers. So we're still quite some distance from having the evidence that would allow us to even understand the safety, the immunogenicity of the COVID vaccines in young children. What's interesting is that young children are not the group that are most at risk of having a serious illness with COVID disease, certainly not the group that is at risk of hospitalization or dying from COVID. And they, curiously, unlike other respiratory germs, they don't seem to be the group that is most transmitting the COVID virus. And so this is not the priority group at this point. The priority really has to be in every country, health workers, older people, those with underlying medical conditions that put them at risk of having a serious outcome. So that's really where the focus should be. And while we're in still a situation where there's insufficient supply around the world and that supply is not being distributed equitably, we really have to keep our focus on those people who are most at risk of serious outcomes, and those are not the children.
All right, Dr. Kate O'Brien from the WHO, thank you so much for your time and for your assessment.
Thank you.
Time now for more of your questions, and that means it's over to Derek.
People keep saying we don't know about possible long-term effects of vaccines, which just sounds like soft vaccine skepticism. What are your views?
I think it's almost impossible to have a fruitful conversation about this topic, because when someone says, yeah, but how do you know there won't be problems down the road? Then that's sort of destined to turn into a pointless discussion, as is really any discussion that requires predicting the future 100%. The problem is, in life and in the pandemic, we always have to make decisions about the future based on data that we've collected in the past. We have to choose our next moves based on what that data appears to tell us. It's not a perfect, infallible system by any means, but it's the best one we have when it comes to decisions like whether or not to get vaccinated. So here's what the current data says about vaccines in general and COVID vaccines in particular. Both the CDC and the WHO emphasize that the chances that vaccines could cause long-term health problems are extremely low, because past experience with many many different candidates for a wide range of diseases overwhelmingly shows that when side effects do crop up, and they do, they nearly always do so within a few days or weeks of vaccination. The biggest vaccine drive in history, though, began many months ago, and hundreds of millions of COVID-19 doses have since been administered worldwide. The rollouts are being tracked with an eagle eye. Authorities have detected a few possible serious vaccine side effects in some very rare cases, but nothing that indicates any wider trends. On the other hand, we have an absolute mountain of data on the potentially devastating long-term side effects that getting COVID-19 can cause. Being able to prevent them effectively is a huge advantage. So with the evidence saying the advantage so massively outweighs any known risk, why wouldn't I want to get vaccinated? I don't have to predict the future to choose that. The data says it just makes sense.
And before we let you go, party only with PCR test or a vaccination certificate. Only then are you allowed on the dance floor in Austria. The new restrictions are a reaction to more and more infected people among young people. The Delta variant is causing a surge in infections. Nightclubs in Austria no longer accept antigen tests. However, partying itself is not being banned. That's all for this edition of COVID-19 Special. Thanks for watching. Stay safe.